Good afternoon. Today we are looking at orthopedic nursing from Mrs. Daka. And we have objectives that we should look at, and we should be able to do these objectives by the end of the course. So we need to explain the role of the nurse in orthopedic nursing. You as a nurse, what is your duty? What will you be doing when you look at this the orthopedic patient, and what kind of procedures will you do on this patient? The second objective is to see the management that you can give to an orthopedic patient and a patient with different conditions. Then finally, we need to rehabilitate this patient. We are dealing with a patient with bones. They have different problems with their bones or with their joints. Therefore, we need to rehabilitate them where we have failed to treat them. Let's move on to the definitions. Orthopedics simply means a branch of science which is concerned with the skeletal system. The skeletal system is basically the bones that we are talking about. The word ortho simply means straighten, while the word ped means a child. So we are literally talking about strengthening the bones of a child. The bones of a child are usually soft, but this orthopedic nursing has advanced. Orthopedics and orthopedic nursing has advanced to embrace other conditions, to embrace other procedures and things that can be done to a patient who has a problem with the bones. Therefore, we will look more at what is being done currently. Let's also look at the terminologies that are used in orthopedic nursing. The first word we'll look at is the word cast. This is a protective shell of plaster or bandages that are molded together to give protection, to immobilize the broken bone, where we'll be able to help the bone to heal using its normal alignment. So basically in this country we use the word tute. You find a person with a broken leg or a broken hand, they have had something that has been put on them that will immobilize that hand or that leg, and it is white in color. It looks like the normal cassava that we know. That's why it is called tute. The other word that we have is arthroplasty. This is basically reconstructing the joint or the joints. There are times when the joints have a problem, or they have a break, or they have been traumatized, or they have been diseased, and they are not able to move. Therefore, we reconstruct so that the movement can be restored in that joint. The other word that we have is arthrogram. This is where we are using an X-ray to visualize what is happening in that joint. Sometimes the joint can have a break, it can be diseased, it can have an injury, it can have a blockage, or it can have an opening which is making it fail to function. So if we want to see what is happening inside the joint, we'll be able to use a needle and a syringe, get some contrast fluid and inject in it, and as the contrast fluid is moving within that joint area, we are able to see, to get x-rays to show what is happening in that joint. So this is basically just to make a diagnosis or to understand what is going on in that joint. The other terminology that we have is the word dislocation. Dislocation simply means the joint has moved out from its normal position, and as it moves out, this patient is not able to move or to do what they are expected to do, or to mobilize according to the normal way. So when a dislocation happens, it means the bone, the joint has come out from its normal position. The other word that we have is active motion. This simply means the patient is able to actively move the joint without any difficulty, without being helped. The other word that we have is ankylosing spondylitis. Sorry for that. Ankylosing spondylitis simply means the joints of the spine or the vertebral column have stiffened and are unable to move. This means that the joints have been diseased to such an extent that they fuse together, or they join together, like if cement has been put in between the joints, and the joints cannot move at all. There's total loss of movement or mobility of the spine. So this is what we call ankylosing spondylitis. It is a type of arthritis. Arthritis is simply inflammation of the joints. The other word that we'll talk about is the word arthritis itself. As I've already started explaining, arthritis simply means the inflammation of a joint, meaning a joint can be inflamed. The joint can have the signs and symptoms of inflammation, which will include stiffness, warmth, swelling, redness, and pain. But in all these kind of inflammations that the joint can go through, they are classified differently, and this arthritis, this topic arthritis, we'll discuss it on its own in detail with the different types of arthritis that can affect the joint. The other word that we have is the word atrophy. Atrophy simply means wasting away, or the muscle is decreasing in its muscle mass. The thickness of the muscle is slowly becoming thinner and thinner, and it is difficult for this muscle to do its proper function. This is what we call muscle atrophy. Sometimes not only the muscle that can atrophy, the bone can also atrophy. The other terminology that we have is aversion. Aversion simply means tearing away. You know, when a bone is functioning, it cannot function without muscles, without nerves, without ligaments. So sometimes these nerves, these ligaments, they tear off and they move. They are disturbed, and the bone cannot function without them. So this is what we call aversion. The other terminology that we have is CT scan, which simply means computed tomograph scan. We are familiar with this word. It's a procedure that will help us to make a diagnosis on a patient when they are having a bone problem. So what usually happens in CT scan is that the patient is put in such a way where the X-ray will be picked from the body of the patient, which will be projected on the laptop or on a desktop, and the pictures will be collected that will show any damage or anything abnormal that is happening to the bone or to the muscles of this patient. So they will be projected as images of X-ray. The other word that we have is chondromalacia. Chondromalacia simply means abnormal softening of the cartilage. The cartilage is one part, the part of the white part of the the joint that lies on each end of the long bone. So this cartilage begins to soften. I want to explain the word cartilage that is following even on this slide. It's a rubber tissue. It will cushion the bones. Remember, let's think of the chicken. All of us, we have seen the drumstick of a chicken. When you eat the meat from the drumstick, you discover that at each side of the end, or both sides of the ends of that drumstick, you find a whitish cover that covers each end of that bone. That is what is called a cartilage. And in chondromalacia, you discover that this whitish tissue that is lying that end of the bone is softened, or it is degenerating. The other word that we have is malunion. Malunion simply means the bone has been broken, and instead of it uniting in its usual and normal way, the bone has not been aligned very well, and you discover that the unity that is supposed to be on that bone is not taking place. It is either uniting on the sides or while overlapping on each other. So this union is not happening in the normal way, and it is very difficult for the person to get the normal shape of the bone. The other word that we have is non-union. Non-union is where the bone has been broken, but healing is not occurring. There is totally no uniting of those two broken bones. The other word that we have is orthotics. This is just a brace or a splint or something that we use to help support the bone so that it is in its proper position, so that the bone cannot move and allow the bone to heal properly. The next terminology that we have is the word crepitation. Crepitation simply means when two broken bones rub each other, they make a cracking sound, and that cracking sound is what we call crepitation. The other word that we have is internal fixation. Internal fixation is a surgical procedure when a patient has a broken bone and we want to align it so that the bone can heal properly. What we use sometimes is pins, wires, or screws, or metal plates, so that we put it just next to the bone and allow these two bones to come together so that healing can occur. The other word that we have is the word kyphosis, where the spine, the vertebral column, instead of having its normal shape, the upper part of the vertebral column bends more outwardly, making a hump on the back, as if someone is carrying something on their back or carrying a baby on your back. And this is a common thing here in this country, and we usually call such people that this person has got a mongo. The other word that we have is the word ligament. This is just a connective tissue. Ligaments are part of connective tissues that connect the bone and the joints so that they can be stable, so that the joint and the bone cannot be dislocated anyhow. The other terminology that we have is the word orthopedic surgeon. Orthopedic surgeon is the physician, the doctor who makes the diagnosis, who treats the patients, and who rehabilitates the patients who are having orthopedic conditions. So this is the doctor who is basically only dealing with patients with problems of the bones. The other word that we have is the orthopedic surgery. Orthopedic surgery is the surgery that we do on a patient, basically dealing with the bones. Anything that is affecting the bone, that will need diagnosis, that will need treatment, that will need rehabilitation, and also that is dealing with prevention of injuries and disease that are affecting the skeletal or musculoskeletal system. The other terminology that we have is the word osteoporosis. Osteoporosis simply means thinning of the bones. The bone mass, the thickness of the bone has been reduced because there is not enough calcium, there is not enough bone protein to maintain its thickness. Therefore, it is the calcium and the bone protein are being moved out or are reducing and making the bone to begin to be thin. The other word that we have is the word synovectomy, which simply means the synovium. Remember the synovium that lines the joints. Every joint does not join to the other part of the joint without the synovium. It needs a cushioning so that the friction cannot wear and tear the bone, the joint. So this is why we have the synovium aligning the joint, and then when we remove this synovium, we call it synovectomy. The other word that we have is the word traction. Traction is simply a procedure which we use to help a patient who has a broken bone or who has a problem with the bone, so that we align the bone into its normal position so that it can heal. In this procedure, we use weights, we use pulleys, we are pulling and we are allowing the weight to pull so that the bone can be aligned in its proper position for healing to occur. Let's look at the traumatic conditions that come in the musculoskeletal system. Basically, we only look at the four things: the strains, the sprains, the contusions, and the dislocations that occur. This is because of the trauma that occurs to the muscles and the skeletal system of a person. Let's look at the contusion. A contusion is where we use a blunt force, like a blow, like a kick, or someone falls down and they end up having the blood vessels rupturing at that area of the body, and allow these blood vessels begin to bleed into the soft tissues of the body. This is basically, we can say it is a bruise. You've been bruised, and because of the bruise that you have had, you end up having the blood vessels rupturing and allowing the blood to go into the tissues around. And when these tissues receive this kind of bleeding, they will change color into purplish color or a darkened color, for us black people, it can be purplish. It is usually black, darker than your normal skin color. So this is what is called ecchymosis. In this contusion, there is also a hematoma that will develop, accumulation of blood in one area. And this is, as this blood accumulates, as this blood collects in one area, it will lead to pain, swelling, and discoloration. So this is what is called contusion. Strain. Strain is simply a muscle pull, meaning when you overuse your muscle, when you overstretch your muscle, when you excessively stress your muscle, the muscle will tear within inside microscopically, and then you discover that the within inside these muscles begin to bleed within the tissue, and this makes the person experience pain, sudden pain in that area, and on that area that pain is localized on the muscles that is affected. The word sprain. Sprain is when the ligaments surrounding that joint have been twisted and overstretched. When they are twisted, the ligaments fail to maintain their normal stability, and they tear off and begin to have the blood vessels rupture, and the same thing that has happened in strain will happen in sprain. So the difference between strain and sprain is that in sprain the ligaments are torn, whilst in strain only the blood vessels are ruptured and hematoma and ecchymosis is occurring. In sprain, the ligaments are torn, the blood vessels are also ruptured, the hematoma and ecchymosis will happen as well. The word dislocation, we have already discussed it, and we have said the dislocation is when the bone, the joint moves out from its normal position. So when this happens, then you know a dislocation has happened and it needs to be put back. This is an orthopedic emergency. A dislocation is an orthopedic emergency, and it needs to have a professional person to have the joint put back in place. So the patient will be in more pain, the patient will have more difficulty, more swelling, and just more than what the person has experienced in sprain and strain. The word subluxation is just a partial dislocation. Partial dislocation is what we call subluxation. Okay, can we move on? So I want to talk a little more about dislocations. They can be congenital, which means that a baby can be born with a dislocation, especially that of the hip, where there's a problem with the hip and the hip has been dislocated, or the baby, while during childbirth, the midwife did not handle the baby very well, and they put the baby's muscles and the hip has dislocated. The dislocation can also be pathological, where this is caused by a disease, or the dislocation can also be traumatic. It's because of the injury. What are the signs and symptoms of dislocations? It's pain. There will be a change in the contour of the joint. The length of the bone of the extremity will differ from the one that is within normal. then there will be loss of normal mobility. The person with a dislocation cannot move in the normal way. They will be limping, or they completely fail to step down. There is also the change in the axis of the dislocated bone. The bone will twist to the opposite direction, and you can only see all these things when you take the patient for x-ray so that the diagnosis can be confirmed. Let's also look at the signs and symptoms of contusion, sprains and strains. They are not very different from the signs and symptoms of dislocations. There are still pain, swellings. The person is unable to move or to bear the weight. Then there will be a misshape in the appearance, and there will be a skin discoloration because of the ecchymosis that we talked about and because of the hematoma. Let's move on. Let's now look at the treatment and the treatments and the warnings, the things that you should be careful about as you look at the person who has a dislocation or a strain or sprain or a contusion. When you look at a patient and you are suspecting a dislocation, do not try to put that bone that has come out back into its position. You worsen the injury. Do not put back the dislocation on your own. Look for the experts. Look for the orthopedic surgeon. And the other thing is, if you are suspecting a dislocation on the neck or on the spine, don't move the patient unless it is really necessary. Otherwise you are going to injure the spinal cord of the patient, and you end up having a patient who will be paralyzed below that injury. It is not fair to have a patient be paralyzed when you can prevent it. The other thing is that when you discover that the patient is having a dislocation and is bleeding on that wound, do not reset or do not reshape that bone. Leave it the way it is. But as you look at this patient, as they are bleeding, check for the signs and symptoms of shock and begin to prevent the shock. We move on. As you try to treat this patient with a dislocation, with a sprain, with a strain, depending on how severe they are, if the patient is already having a weak pulse, call for help. Call for help and loosen the tight clothing around the patient so that blood can flow freely. Ask or call for help. Shout for help. Then the other thing that you should do is that if the patient is in severe pain because of the injury on the neck, on the spine, on the hip, on the thigh, just call for help before you can do anything, because you cannot lift, you cannot move this patient alone. You need help. Remember, nursing is a career where we help each other. We work as a team. We don't work alone. The other thing that we need to remember is that if the bone needs to be repositioned, don't give the patient anything to eat or anything to drink. Just allow the patient to stop, so that in case that repositioning needs to be done in theater, the patient can go to theater without any worry. So prepare the patient so that they can go into theater without having taken or eaten or drunk anything within the past 1 hour or so. The other thing that we want to talk about is you need to remove the clothes or the jewelries that the patient is wearing on that area or that affected area, so that you can allow blood flow in that area without restriction. The treatment, when you are treating the patient with sprains, strains, and dislocations, we use the word price as a technique to treat this patient. So you should always remember the word price. This word price simply means protect. Make sure you protect your patient. Make sure you protect the affected area, and make sure you rest the area that is injured. If time allows, make sure you use ice to minimize the swelling. If there's no ice that is available where you are working from, you can pick anything that is frozen in your fridge, like vegetables or a packet of water that is frozen. Then you can use it on your patient. Then the C stand for the word compression. So where you are going to put a bandage or something that will compress to decrease the swelling in that affected area, so that you can ease the patient's pain. And the last word in that word price is elevation. Ensure you elevate the injured limb above the heart, so that the blood flow can continue to come back without any difficulty. You can use a pillow, or you can fold a blanket and use it to elevate the part that is injured. So always in treatment for sprain, strain, and dislocations, use the word price. P for protection, R for rest, I for ice, C for compression, and E for elevation. Thank you very much, and God bless you. Bye.